What are the differences in assessing treatment in different areas?
Well, one of the things you'll find is that each state has its own rules and regulations, so we'll just have to plan ahead. For example, if you're thinking about going on a holiday interstate or something, we have to pre-arrange that all the paperwork and all the different processes follow you from one place to another, and that you meet the requirements of that other state. The other thing you'll find is that it's often done differently in a city area compared with a rural area. Now, probably the first thing you'll notice is that when you go to a rural area, you don't have the same range of services. You don't have quite often the dedicated drug and alcohol services with a specialist type model. In most cases in a rural area, the easiest thing is to contact the community health department from the local hospital there first, and they'll tell you who are the local prescribers in that area, who are almost certainly GPs. Now, they will still work in a team, so there will be drug and alcohol specialty trained nurses and so on, and there'll be different chemists that you can pick up your dosing from, or from the hospital. It'll vary area by area, but all of those people won't necessarily even be in the same town, let alone the same building.
We notice that when people travel, when we have patients traveling interstate, they need to know that other states don't recognize my script from here. So someone goes to Victoria, they need to find another prescriber in Victoria to access treatment there. So we help them with that anyway. That shouldn't be a hurdle for people to travel if they want to travel.
One of the consequences of having treatment in rural areas, being in different locations, is that you might have to travel. You might see your prescriber in one town, but you might be picking up your dose perhaps from a chemist that's not even in your town. Not every chemist will be involved in dispensing methadone or other medications. That might be for personal choice or for financial reasons, or because they don't have the particular lock-up space, for example. Each chemist makes their own decision, each hospital makes their own decision, and you may have to travel. Now, immediately that says that there may be a cost in travel. You might have difficulty, for example, getting a bus to the nearest place. Again, contact your community health system because they often have transport assistance schemes that can help there. The other aspect, of course, it may be dangerous to travel. Sometimes in rural areas, please don't hitchhike. Hitchhiking, as you know, is not something that you can guarantee will be safe. And I think particularly if you're travelling early in the morning or late in the evening, and dosing times often are at those times, that's just something to be aware of.
And for those who've seen films like Candy, it would seem as if methadone just comes from the sky somehow. You can travel off from an urban area to a rural area and all of a sudden methadone is provided to you. It's not usually like that. It's usually a bit harder to get on a program than portrayed sometimes in some of the films.
And I've found that methadone is available even in the most remote country areas, and I can get methadone, I can get my dose, and I can maintain a normal life.